This is Dr. Dean Kelaita, Calaveras County Health Officer, with an update for the community about novel coronavirus, COVID-19, and how we can expect to lift the stay-at-home orders that are involving our community today. As of Tuesday, April 21st, there are over 30,000 cases of COVID-19 infection in California with 1,200 deaths. Calaveras County has 12 reported confirmed cases and no deaths. So far, Mark Twain Medical Center and the healthcare system of Calaveras County have not been overrun. Hospital surge plans have been activated to increase hospital beds, ICU space, and ventilator capacity, and Public Health has set up a 30-bed alternate care site at Calaveras High School in San Andreas in case we need it. Statewide, as well as our local public health, stay-at-home orders have enhanced social distancing activities and effectiveness. We're successfully flattening the curve, delaying new case occurrence, and sparing the healthcare system. I'm extremely proud of the job our county residents are doing. Sacrifices on the part of the public in suspending group activities, non-essential business and travel, and basically sheltering in place over the past 4 weeks have significantly blunted the impact of COVID-19 epidemic in our community and have saved lives. The public is growing weary. People are increasingly frustrated, anxious, and looking forward to getting back to life as we all knew it. I'd like to provide some scientific and evidence-based predictions regarding what factors need to be put into place to allow for opening things back up and what time frames we can expect them to happen in. I'll preface these predictions on the facts that the state of California indicators and guidance would supersede my projections. We're still under a statewide stay-at-home order. These underlying assumptions are that social distancing activities will continue until deemed no longer needed, that new case counts remain low, and the governor's stay-at-home executive order is in time rescinded. Late April to mid-May, I suspect the number of new cases will be flattening, and the relaxing of community mitigation activities is contingent upon the outbreak remaining stable and transmission of disease being controlled. Under this scenario, I would propose in early May the reinstitution of solitary outdoor activities such as golf, parks, hiking under these conditions, assuming they be conducted with adherence to strict social distancing practices. By the end of May through mid-June, places that have effectively maintained social distancing measures will continue to see significant reductions in cases. By this time, there should be enough testing capability locally to meet the demand for more wide-scale testing programs to respond to isolated COVID-19 activity and enact surveillance and investigation efforts to track the disease in our community to stamp it out. Stay-at-home orders should persist toward the end of May and into mid-June. Antibody testing should also be available by this date to help identify those with immunity to allow for safe return to the workforce. Mid-June to the end of July, the easing of stay-at-home policies. By early summer, we should see tailored approaches for getting people back to work. This won't be a one-size-fits-all approach. It will depend on how capable public health is in containing new outbreaks and having beefed up our staffing to aggressively investigate and identify them before they grow out of control again. High-risk people will continue to shelter in place. Immune individuals identified through antibody testing may start to go back to work first. The reopening of stores and restaurants, but limiting the number of patrons, waiters wearing gloves, masks, disposable menus, and employers will be encouraged to allow telecommuting for eligible and applicable businesses and employees. So things will look different. Late summer, measures will be into place to rapidly detect and respond to disease resurgence. Schools should remain closed, no summer school or other school-based activities such as daycare. Schools will likely to be reopened in the fall with social distancing. If increased cases result, schools will need to send students home, close individual schools on a case-by-case basis, or face more widespread closures again. If large numbers of cases continue by the end of summer, it would not be wise to reopen schools. Factors that could alter this timeline, in addition to improved testing capability and beefed up public health department staffing to test, contact, trace, and isolate new cases, would be the development of new drugs, a vaccine hopefully at some point in the future, and viral susceptibility based on warmer weather. I'd like to encourage the public to stay flexible. If this first wave decreases, we could be in store for a second wave in October or November later of this year. So it's going to be contingent upon everyone in the community to stay this course, maintain these social distancing practices for the time being, and look forward to a phasing in and reinstitution of a lot of the non-essential activities that have been prohibited for now in order to get our community up and running again in the future. It's going to be a process. The hard work that we're doing is paying off, and more information will be released to the public as soon as we can get it. And I'd like to take this opportunity to thank CCTV for allowing me to bring this message, and I'd like to continue to do this on a weekly basis if they'll continue to have me. Thanks for your attention.